Hello, everyone. Thank you and welcome to Open Heart Discussions. I'm Lacey Fisher, licensed professional counselor supervisor and registered play therapist supervisor. I'm the owner of Open Heart Counseling ATX. And I'm happy to be chatting today with Dr. Michelle Andoy so we can learn about pelvic floor therapy and learn a little bit about her and the services she provides. So, Michelle, I'm going to turn it over to you. Can you first tell us just about yourself and your credentials?
Thank you. Thanks for having me
Yeah.
today. So, I am Michelle Andoy, and I specialize in pregnancy and postpartum physical therapy at Resilient RX here in Austin. And a little bit of background about myself is I got my doctorate in physical therapy at SUNY Downstate Medical Center, or now the Health Science Center in Brooklyn. And a majority of my training and skills were from my previous women's health and pelvic floor clinical affiliations during physical therapy school and at my previous job at an orthopedic and pelvic health clinic in New York City, where I worked extensively with the prenatal and postpartum population and individuals with pelvic floor dysfunction and pelvic health. So, and I also had an additional pelvic floor rehab training at the Academy of Pelvic Health through the American Physical Therapy Association. And I am still seeking out continuing education on several topics related to pelvic health because some people may not know this, but physical therapy is a profession where there is a continuous journey of learning. So that's a little background on myself and my profession.
Yeah. Do you mind telling us a little bit more about extending on that in your professional journey and your leading up to your current work?
Of course. So, like I mentioned earlier, during my last clinical affiliation, I interned at a orthopedic physical therapy clinic with a focus in pelvic floor dysfunction. And this is where I had a lot of my on hands clinical training for my specialty. And after graduating, that place actually offered me a job. So I started working there at that same clinic. And this is where I mainly worked with individuals with pelvic floor dysfunction and pain and with the prenatal and postpartum population. So I worked there for about 2 years. And then I decided to move down to Austin, Texas. And then I joined Resilient RX. And, I've been here for about 4 months now. So, and I'm continuing to do the same work, primarily working with the postpartum and prenatal population. And I also work with individuals who weren't pregnant but are also experiencing pelvic floor dysfunction or pelvic pain and helping to rehab that.
Okay. One question I want to know is if talking to a few of us, like I'm a mental health professional, and I think it's incredible that you recognize them. You originally reached out to me to say, hey, I want to be able to refer people to when they need that extra emotional support, that mental health support. So can you tell me about why mental health awareness is important for this group of people that you work with?
Yeah, of course. So I think that mental health awareness is so important because it's not typically addressed when it comes to physical or musculoskeletal injuries or conditions. And a lot of times when people have an injury, there are also some psychological or mental factors that play a huge role into what I'm actually seeing going on with the body. So there's, like we talked about before when we spoke previously, there's such a strong mind body connection when it comes to these things. And it's very important that we address that and people have a resource to seek help with their mental health because it's so important in recovery of function.
And just tell us a little bit more about pelvic floor therapy. That's one thing I really meant to ask you, in kind of addition to the last question I had. Yeah, just tell us a little bit briefly about it.
Sure. So the pelvic floor is when you think of the core, you're probably thinking of just your abdominals, but I like to refer to the core as four muscles. So your diaphragm, which is at the top, your abdominals are in the front, and then you have your back muscles, of course, in the back, and then your pelvic floor is considered the floor of the core. So, and all these muscles have to work optimally in order to function. And the pelvic floor has so many roles. It plays in sexual function, support, and stability, and it's responsible for us to go to the bathroom properly. So with pelvic floor physical therapy, if someone is having an issue when it comes to sex, or maybe they're having incontinence, pelvic organ prolapse, or they just have a weak pelvic floor, and those are just some conditions, to name a few, under the umbrella term of pelvic floor dysfunction. They can be evaluated by me. So I take a full evaluation of what's going on in the body. So I'm looking at their general strength, their range of motion, and this is all externally without my internal assessment. And then I can also see how they're walking, if that pertains to their issue that's going on. And I also perform a pelvic floor muscle assessment that is internal. And that just is a bigger picture onto what's going on in the pelvic floor if the pelvic floor is involved in their injury. So I take a look at the strength, coordination, if they're able to fully contract and relax the pelvic floor, and just to see, what's going on in that system, and then taking that information and then coming up with an individualized treatment plan in order to get to where they want to be and to achieve their goals. So that's what I do.
That's so important, the individualization, right? Everyone is going to come in with some different things, and you looking at that and how the body connects with the mind. And you said being able to recognize if someone needs some extra support, and just it's so great that you know about that connection. And can you tell me, what are some of the things that you're really passionate about in your work? You mentioned that you worked with a lot with the perinatal population. Can you tell us more about your passion with that, and how that came to be for you?
Right. So I think it's very important to provide education and treatment through a holistic approach, especially in the recovery of function, especially, pregnant women, and then also in the postpartum period. There's such a big change that is going on with the body. And after giving birth, we might not be aware of the changes in our body. So when we jump into activities such as, maybe just going for a run, maybe that's something that you were so used to doing before you were pregnant, and then realizing that maybe you're not moving in the same way, or maybe you are experiencing incontinence or experiencing pain. I'm really passionate about providing that education and that individualized treatment in order to empower people to seek professional help so they can get to where they want to be. And because I worked with people in the past that, sometimes it's really mentally, destructive when someone has told them that, they can't run anymore, or, they're just going to have to run while peeing their pants now, and have to deal with that for the rest of their lives. So that really has a big impact on people's livelihoods. And I'm just really passionate about, being there to guide them that, you don't have to live with this. This isn't something that is normal or you should have to live with, that there are solutions and that I can provide them through treatment.
So let me ask you this in this way, if you're able to respond: why is pelvic floor therapy important to the perinatal population, the pregnancy and postpartum?
So because there are so many bodily changes that go on during pregnancy and postpartum, there's a huge impact on the actual pelvic floor muscles. So when you're pregnant, the abdominal area is being stretched over time. And when you're giving birth, if you're giving a vaginal delivery, or if you're having a C-section, no matter how you're giving birth, the pelvic floor is going to be impacted in some way. So muscles are being stretched out. And because those muscles are stretched through a period of time, after that period, the body isn't really familiar or isn't used to adapting to those changes. And so contracting the muscles and then also relaxing the muscles becomes difficult. So does that answer a little of the question why it's so important? Yeah. And there are just, even if it's not maybe if they don't have a weak pelvic floor, a lot of times people are told that, just do Kegels, that'll be okay. But sometimes it's important to know that, Kegels don't cure everything. Sometimes I see clients that have been doing many Kegels, up until giving birth, and then their pelvic floors are actually very tight. So it's important to know that you can have a very strong pelvic floor, but it doesn't necessarily mean that it's functional. So, and when there is a very tight pelvic floor, that can lead to other pelvic floor dysfunctions as well.
That leads me into a question. I want to know, it ties into what would you want other professionals, let's answer in a second what other you would want other pelvic floor therapists to know, if you needed to give a message about something that's important. But thinking about, like, say someone like me and a mental health therapist who maybe I don't know that much about it, and I want to let my clients know that that option is available. What is it that you would want them to know that they could say, oh my gosh, that is an option. That is something I need to go do. Why is it important?
Right. So a lot of times people, when they first notice that there's something wrong with the body, that they tend to, hold off, maybe feel that it might go away in a few days or a few weeks. But if this is something that is persisting for a long period of time, you don't want it to become a chronic issue, especially, postpartum. You're now having this expectation, to go on with your daily lives in the way that, you pictured it. And sometimes people are told that by 6 weeks, you should be normal, and it's okay if you feel like you're not there yet. So, pelvic floor physical therapy is so important to this population because we are guiding them in the direction that they want to be, and also that, mentally as well, that we are offering something that, is a solution even after they've been hearing that there are no other solutions for them as well. So I just think it's very important to, even if you feel like something has been going on for a certain amount of time and you're not really sure if it's going to get better in terms of your sexual function, maybe there's weakness or pain in the body, or maybe you're experiencing something like a pelvic organ prolapse, or a diastasis, or something that just doesn't feel right, it's okay. Go seek help at a physical therapist, especially who is really well trained in these things, because there are options that, so that you don't have to live with this for the rest of your life.
So would there be anything that you would want other professionals to know that are like your colleagues or who do the same work?
Right. So I would say that, it's very important that we need to listen to our patients and our clients. A lot of times, with our healthcare system, we're very quick and fast when we're seeing new patients or new clients. So I think it's very important to take the time to listen and to hear them out, because a lot of times if we just sit back and listen, we actually find so much more what's going on. And then it helps us, figure out a treatment plan. And, typically there's better patient outcomes when we just give them the time to talk and we listen to them. So I think it's very important for other professionals to know that as well.
Yeah, thank you for that message. And I will say for other mental health therapists too, of us just knowing that that's available, that's there for a multitude of reasons, for in the perinatal period, but also, and I want to tie this into my next question. I often get people asking too, I'm having pain during sex, and this could be for someone who is in the perinatal period or not. They've maybe had a traumatic history or sexual abuse history. And I want to know from you, like, basically, what are the taboo subjects that we're like not talking about? And can you inform us a little bit of some of those?
Right. So, the pelvic floor is in such an intimate area of the body. And for some reason, in this culture, we just don't like to talk about it. And after giving birth, we're expected to, like I said before, go back into our normal routines. So a lot of times people think that talking about sex, or, talking about arousal and intimacy is something that's very taboo. But again, this is something that's very important to, our livelihood. And especially, the first thing I want to know is, why do they want to have sex? Like, why is there pain? Do they want to go back to sex because they want to have more children? Do they want to have sex for pleasure? So that's very important to establish those reasons first. And then going from there, like, is it arousal, or is there a physical component to this, that the pelvic floor, there is something going on with the pelvic floor that's preventing them from having sex without pain? So it's very important to address those things. And then what's great about pelvic floor physical therapy is that there is no too much information or TMI when it comes to this profession. So when I have clients in, they can, tell me anything, because knowing this information is very important to their outcome in the end. So, in this culture, we typically don't talk about these things, but again, it's very important, and something that we need to address normally and shift the way that we usually think traditionally when it comes to these things.
Yeah, absolutely. I mean, and I get that a lot too. And I can understand where, I do have to reinforce to people over and over, there's no TMI. You can tell me that's important. That's part of your mental health and what you're seeking services from me for. But I mean, I even imagine you get that too, even though that's your area and people are going to you for that they still probably get a little, shy maybe to talk about it. And I think we're both saying we want to let you all know, just tell us. That's okay. It's important. It's part of you. And it's not something that we should be ashamed of or afraid to talk about. We're
right.
In that way.
Right. And I feel that, a lot of times people think that just because people close to them haven't experienced that they should also not experience that as well. But, it's something that is fairly common. But again, since we don't talk about it, usually, like, people would never know that. So this is the time where we need to, shift that way of thinking and talk about these things more and make it become routine in women's health, especially, having that conversation, because a lot of times these things go unaddressed, and, then the patient is left with, kind of feeling lost, or maybe not feeling that they didn't get the treatment that they expected. So I'm really glad that we're having this conversation today.
Oh, yeah.
We can talk about these things.
Yeah. And on that note, is there anything else that that you want us to know, or any other subjects you feel are important to bring up or be aware of? What else do you want us to know?
So I just want to, continue to talk about the statistics in this, because I think it's 1 out of 4 women have a pelvic floor dysfunction. And like I mentioned before, pelvic floor dysfunction is more of an umbrella term. So I just want to clear this up. So things like pelvic pain, or pain with sex, or chronic pain, incontinence, constipation even, pelvic organ prolapse, all of these things fall under that pelvic floor dysfunction umbrella. And it's very, sometimes people feel embarrassed that these things are going on. And I just want to note that just because something is common doesn't mean that it's normal, and that they don't have to live with it forever. So, I want to empower people to seek professional help if they can, especially if they're dealing with something for such a long time. You want to prevent these things from becoming a more chronic issue, because then when it comes, after several years of dealing with these things, it becomes, harder to treat, essentially. But there are also, it's never too late to seek help, right?
That's good to know, because I think, and I mentioned to you that I've heard several clients say, I'm just told, like, I think this is it. This is the end of the road for us. I'm not sure what else I can do for you. And for various different reasons that someone is going in to see a pelvic floor therapist. And I'm happy to know that there's people out there like you that are saying, you know, well, no, let's come talk and let's see what you can do to help them so they can try to feel like they have that bit of themselves back.
Right, right.
Yeah. So do you want to tell us about any other resources that you're aware of? And especially tell us about, particularly, you said you work at Resilient RX.
Right. So Resilient RX, we are a clinic off of 360 Capital Texas Highway. And we are also offering free 15-minute consultations, also free 30-minute discovery sessions. So if you're on the fence about coming to pelvic floor physical therapy, or you're not sure if it will be beneficial for you, we offer those free consultations. So you can feel free to call the clinic or visit our website and schedule that. And, you know, I'll be there to give you that assessment to see if this is something that you could benefit from. And then also just, you know, talk about the body and anatomy. Just that education is very important in understanding why all of these things happen to the body in the first place. So just like just being educated in that stuff really, really helps with the whole process.
Yeah, that really is a huge piece of it. Just that, oh, there's these terms for it. That's what's going on. That you know, that can create a great starting point and relief for someone. So yeah, if there's anything else you want us to know, please. Oh, a good thing is, how can someone get in contact with you?
Right. So if you would like to get in contact me, you can call us at 512-777-0330. That's the clinic number. And that, so our receptionist can pick up, or I might pick up, and you can schedule a free 30-minute discussion if you are unsure if you can benefit from pelvic floor physical therapy. Or if you definitely know that you need pelvic floor physical therapy, you can go ahead and schedule an appointment with me. So you can reach us through that. Also our website, resilientrx.com. You can view that if you'd like to know more information about our clinic and where we're located. So there's you can reach us out through there.
Yeah, and I want to ask this too. It just something that I think is important. And do you notice in your work, are there some differences for women of color that are coming in, and some special considerations that we need to have around?
Right. Yeah. So it's very important that, you know, we know that there are certain disparities between, you know, women of color, especially in women's health. I think there are some studies that, you know, have seen that the outcome, like health outcomes, have been far worse in those populations. And also it, you know, because of that, you know, women of color are not as, I guess, reluctant to seek help when it comes to these things. And I just want to, you know, give out that, you know, physical therapy and pelvic floor physical therapy can benefit anybody. And, you know, there's no discrimination when it comes to race or color. And that, you know, from the history of, you know, a treatment of people of color in, you know, in healthcare, it, you know, kind of, you know, makes me think that, you know, we need to do something about these things and, you know, offer our support, and then that we're not here to judge or discriminate, and that, you know, and then everyone, you know, treat everyone equally and holistically in order to get, you know, in order to get the outcomes that they deserve and that they expect, because everyone deserves, you know, the pregnancy that they deserve. Everyone deserves the pregnancy that they expect and that they want. And it's so important to advocate for yourself.
Great. And I'm glad that you're there to help do that too. Like I said already, the fact that you reach out to me and you want to make that connection, to know that when you're working with someone, I can see that you will have a whole team of people around that person if they need it, to support them in whatever way. So I really thank you so much for your insight today and being a part of this little project that I have. Yeah. Anything else before we sign off?
I think that's all I can think of now, but thank you so much for having me on. This was a really, really great thing to do.
Yeah, awesome. All right. Thank you so much. And you have a great weekend.
You too, Lacey. Bye.
Bye.